All right, so there has been a lot of sad public health news as well as just like weird news in a week. And I just want to go over a lot of things, especially when it comes to Twitch as well as like mental health, because that has been such a topic this week. So basically, Stefan Twitch Boss, which was the DJ for Ellen Show for a long time, has passed away this week. Basically, he had unalived himself. He was pronounced unalived around Tuesday morning in Encino, California. If you follow Twitch on the years, he came up during Dancing with the Stars, and that's how he got his first notoriety. That's what helped him propel him to the role of Ellen's DJ for the past few years. I saw a few episodes of Ellen when it was good, and basically I love seeing him because literally he could light up a whole room, as many of his family, friends, and his wife have said throughout the past few days. I think what the saddest things about this is that he was found a few days after posting this video on Instagram with his wife dancing in front of the Christmas tree, getting the holiday spirit. He's leaving behind 3 children with his wife, as well as they just celebrated their 9th year anniversary a few days ago. It was discovered that Twitch's wife, Allison Holker, informed Los Angeles police about him missing, as well as him leaving the house without getting in his vehicle, which is unusual behavior for anyone. From there, police received a call from the Oak Tree Inn in Encino, Los Angeles. He had unalived himself in a hotel room, and whenever the staff came in to go find him, they basically, found him in that state. But a lot of people feel like this is very ominous, or this is very somber, because it also came out on the same week that Kendrick released his Count Me Out video. About a lot of imagery from mental health, as well as him being a fallen angel, as well as going into a deep depression. I feel like this is no coincidence that these two things happen in the same week, because I feel like we not only just not talk about mental health enough, but I'm talking about black mental health, especially when it comes to black men. Because also in the same week, this topic of black men of unaliving mental health came into my inbox on my feed, basically on LinkedIn. Basically, he's talking about life satisfaction for black men is really at a all-time low, or never really has been at a high, because really that satisfaction has been made and set by racism as white supremacy, as well as black men always been told what you are and who you are, and not really trying to find themselves a very few Kendrick has. He says it perfectly right here. He says it's perfectly right here where it says, at times it becomes confusing to know whether we are portraying the image black man right or wrong. The thoughts of black men circulate daily without much room for error or forgiveness, and there's a constant inner battle with the struggle to know how to communicate this unspeakable feeling. And just think about it, the common narrative surrounding black men in our society is either being a football player, a athlete of some sort, is being a basketball player especially, or being a thug, being a criminal, being a dealer on the street, not living up to life potential, or being a victim of the system, or being in jail. Those are the common narratives in black men, whereas people like me who don't fall into either or basket, who kind of wants to be a scholar, wants to be a doctor, or black men who don't want to go into sports or want to be out on the streets, they want to do different things, be a dancer in Twitch's case, that's not common. And oftentimes we are faced with the questions of, are we not black? Are we different? Are we belonging in the black community? Because of these narratives that play into our society, and especially as these narratives play into the stereotypes of toxic masculinity, you have to be rough, you have to be physical. If you don't fit that, then you are not considered man. It leaves a lot of us to question are we really men in today's society? This conversation is not obviously going to be had in this video, because this is just a reactionary based video, but this conversation need to be talked about more in academic circles, in the barbershops, in the streets, and basically just in every household. Because at the end of the day, there's no reason why this man, 40 years old, I don't know what he was going through, but if he was going through something dark and he felt like he was facing it alone, then this is a bigger problem in society, because a lot of black men has felt like this and are feeling like this right now. Now, shifting gears to the Texas border, Texas Governor Greg Abbott, Applehead Abbott, says the end of Title 42 will bring total chaos, which, newsflash, it won't. Basically, the governor said if the courts do not intervene and put a halt to the removal of Title 42, it's going to be total chaos. Texas is part of a coalition of Republican-leaning states that has pushed to keep Title 42 in place, despite Biden's administration and civil liberties advocates saying it's time for a hardline policy to end. If you don't know what Title 42 was, it basically was put into place by the Trump administration. It has been used in the early weeks of the COVID pandemic to try and not let people come into the border who they thought would spread COVID into the US. But in actuality, it's been the white Karens who refused to sit down during the early stages of the pandemic that was spreading it throughout the population. But neither here or there. Biden basically wanted to remove it because the pandemic is not over, but the conditions are getting a lot better than they were years ago, as well as like we have vaccines, we have medicine, we have science to be able to fight back with the pandemic. This was initially a public health order basically for the COVID pandemic specifically. And so now that the pandemic is deemed to be quote unquote over in many people's eyes, people are saying like there's no need to have this policy in place anymore. The Republican Party, especially Abbott, have been so vocal about ending restrictions, public health restrictions and all that, but yet they're trying to push back on Title 42, which is a public health restriction. The reason why a lot of people are hot and bothered by it is because there is expected to be a surge of migrants coming through the southern border and going to cities like El Paso and Eagle Pass, who are already experiencing, a lot of influx. And basically, Abbott is falling back to the same rhetoric as Trump, saying like, oh, these are, illegal immigrants. They're bringing cartels. They're bringing murders over to the border. They're trying to put more fentanyl in the country because, which y'all didn't know, fentanyl, a lot of it comes from not just within the U.S., but also across from Mexico. But what a lot of people don't know is that a lot of the fentanyl seizures are not coming from people just necessarily just sneaking over the border or like trying to go unseen. A lot of these happen at ports of entry. This is a picture of a border crossing in California near Tijuana on October 23rd. And basically, this isn't where like people can just like go sneak over or go across. They have to go through by a car, which means that drug cartels are using actual vehicles to transport them into the US. A lot of the fentanyl entering the US is coming through official border crossings, not through mountains or deserts, as like they're trying to get you to like see. These are coming through actual legal, search and seizures, and them just like vacating and getting past those search and seizures because we don't have the technology to actually detect this fentanyl coming in. What I'm just trying to say from this whole thing is like, make sure you watch and do research on what politicians are saying, because oftentimes it's rhetoric to appeal to your fears or emotion and just say like, oh, this is causing this and we need to shut down the border for this. They're just letting you see what they want you to see. And basically, hopefully you can react to it when, for one, there's no border crisis for a country that didn't respect boundaries of Native Americans. Let's just get that straight. Two, a lot of the fentanyl that's being, brought over to the US is coming through cars, not by actual people. So do your research. What he's saying is a lie. The border crisis is a lie. There's no border crisis. What we really need to do, we need to fix our immigration policies and actually make it more, effective and efficient for people to get their citizenship, so they wouldn't have to cross through the border, or they wouldn't have to like really just sneak across the border, or like trying to like be quote unquote illegal, when in actuality they're trying to have a better life here. All right, so for this last story today, this is a point why you actually need to read research and actually get a scientific acumen. This new study that's linking COVID-19 vaccination. In this study, the Canadian researchers examined over 11 million COVID-19 vaccination records of individuals over the age of 18 who will be licensed from different social, economic, health backgrounds. Of those 11 million, 16% were not vaccinated. They were able to identify that individuals who hadn't gotten a COVID-19 vaccine were at greater risk of traffic accidents, but it wasn't because of the vaccine. The link actually comes down to risks associated with decision making in relation to decisions concerning getting vaccinated, and also to obey or not obey traffic laws. Of course, this isn't saying that if you didn't get the shot, you're going to get into a traffic accident or cause a traffic incident, The correlation doesn't work that way. However, researchers concluded if an individual is hesitant or willing to protect themselves with a vaccine, these same people will be more likely to have no regard for traffic laws. But in all seriousness, while there's no direct link between the vaccination status to car crashes, that same mentality of you being hesitant to like do the best thing for the wider population and get vaccinated kind of goes into your decision making and driving safely and obeying laws that make the wider population safe. Please go get your vaccination. Like, it's free for the majority of people. Please just go do it. Like, it doesn't hurt you in the long run. You might get sick for a few days, but at the end of the day, you're getting the immune system like boosted up. So please get your vaccination. With that being said, these have been the top public health stories of the week. If you like what you see today, like, subscribe, post notifications, all that one for good stuff. If you want some of my other content, there are more videos right here. But with that being said, stay warm, stay frosty, depending on what part of the country you're in, and peace out.